name is Manu. I'm 12 years old. I'm going to be 7th grade next year. I live in Milwaukee, Wisconsin, USA. Now I'm going to be talking about COVID-19, a geographical distribution and trend in my state, a prevention and cure and recommendations on social gathering. Now let's see how the novel coronavirus was identified and its timeline. Coronavirus pandemic started as reported on New Year's Eve 2019 in the city of Wuhan, China. Still, the origin date is not known accurate. 21st December 2019, Wuhan Municipal Health Commission, China, reported a cluster of cases of pneumonia in Wuhan, Hubei province. January 2020, World Health Organization reported about the outbreak of a new disease caused by this new virus. China publicly shared the genetic sequence of COVID-19. Thailand confirmed the case of COVID-19, the first recorded case outside of China. World Health Organization experts visited to Wuhan. January 30th reported 7,818 total confirmed cases worldwide, with a majority of these in China, and 82 cases reported in 18 countries outside China. World Health Organization gave a risk assessment of very high for China and high at the global level. February 2020, WHO releases strategic preparedness and response plan to help protect states with weaker health systems. WHO convened a research and innovation forum on COVID-19, the WHO China Joint Mission. March 2020, alarming levels of spread and severity. COVID-19 Solidarity Response Fund launched. WHO and partners launched the Solidarity Trial. April 2020, the novel coronavirus has infected more than 1.1 million people and killed more than 60,000 worldwide. The US has more than 300,000 cases and more than 8,100 deaths, according to revised figures. May 2020, more than 5.8 million cases of COVID-19, more than 360,000 deaths from COVID-19. June 2020, more than 10 million people across the world have been infected with the coronavirus. More than 500,000 have died from the coronavirus. July 2020, at least 33 U.S. states experienced an increase in new coronavirus cases compared to last week. Cases keep rising in the Australian state of Victoria. Another 273 infections have been recorded. Infections in Latin America and the Caribbean surpassed 3 million this week. Now this is the distribution of COVID-19 cases worldwide as of 28 July 2020. This is how it looks like. Now let's see the COVID-19 status in Wisconsin by state. COVID-19 remains very contagious, and most people in Wisconsin are still at risk of getting sick from the virus. Regions and counties are classified as high, medium, or low activity levels for disease spread by combining the case burden and trajectory indicators. Burden is the total number of cases per 100,000 Wisconsin residents in the last 2 weeks. Trajectory is the percent change from previous to current week and week. COVID-19 activity level is a summary indicator based on whether the burden status is low, moderate, moderately high, or high, and whether the trajectory status is significantly shrinking, growing, or have no statistically significant change. Let's see what's happening in my county, Oak Creek. COVID-19 is still spreading in our community. To lower the risk, we continue to practice physical distancing and avoid gatherings. The temporary public health order has expired. All businesses are encouraged to reopen safely, implementing safe business practices and physical distancing between employees and customers. The Center for Disease Control and Protection and Wisconsin Department of Health Service recommend wearing a closed face cover when you are outside the home conducting essential activities. As of July 27, there are 449 positive tests, 282 recovered, and 15 deaths in Oak Creek. A 14-day quarantine upon return for anyone who travels to any U.S. states with confirmed community spread of COVID-19. Now let's see some recommendations for social gathering. Social gatherings should be completely avoided because if there is one person infected with the virus, the whole community will be infected. Virtual gatherings are recommended where you can reach more people in less time. At the same time, completely sitting online is not recommended for your health. We need to redefine certain things if we want to continue living here. We need self-discipline, good hygiene, respect fellow living things, and we shall not lose hope. Nothing is permanent. There will be a solution. Now let's see the latest vaccine development for COVID-19. China has 5 COVID-19 vaccines in clinical trials. Russia successfully completes clinical trials. India will soon do the clinical trials of Ayurvedic drugs for COVID-19 treatment. UK University of Oxford has developed a vaccine that triggers immune response. It is made from a genetically engineered virus that causes the common cold in chimpanzees. It has been heavily modified. First, so it cannot cause infections in people and also to make it look more like coronavirus. Scientists did this by transferring the genetic instructions for the coronavirus spike protein, the crucial tool it uses to invade our cells, to the vaccine they were developing. This means the vaccine resembles to the coronavirus and the immune system can learn how to attack it. National Institute of Health has started phase 3 clinical trials. The vaccine known as mRNA-1273 was co-developed by the Cambridge, Massachusetts-based biotechnology company Moderna and the National Institute of Allergy and Infectious Disease, part of the National Institutes of Health. The trial, which will be conducted at U.S. clinical research sites, is expected to enroll approximately 30,000 adult volunteers who do not have COVID-19. Having a safe and effective vaccine distributed by the end of 2020 is a stretch goal, but it's the right goal for the American people. I hope there's a solution in the end of the year. Stay safe, everyone. Thank you for the opportunity.